I am Dr. Greg Wilson. I'm a consultant medical oncologist at the Christie Hospital in Manchester. Cancer is where normal cells in the body, which would normally grow in a regulated fashion, lose their ability to grow normally and start growing abnormally. When cancer cells grow, they start to multiply, and when you have enough of them in one area, that becomes a tumour, which is something that a patient could see or feel. Those tumours can then develop the ability to get into the blood or into the lymph system and then move to other parts of the body, such as the liver or the bones or the lungs, for example. A benign tumour will only grow in the area that it starts in, whereas a malignant tumour is a tumour that has gone a step further and has got the ability to move into another organ, such as one close to it or into another part of the body. The problem with most cancers is that when they develop the ability to move, one of the first places they get into is a blood vessel, and then the bloodstream can take those cancer cells to another part of the body, and that results in secondary cancer or metastases. When we use the term primary cancer, that refers to where the cancer originated. So a primary cancer of the breast would be a lump in the breast. A primary cancer of the bowel would be a tumour in the bowel. Those cancers can then move into bloodstream and develop into secondary cancers elsewhere. When we use the term recurrence of cancer, we usually are talking about recurrence of the primary cancer. Usually that cancer will have been removed by surgery, and then if the cancer comes back at a later date in that area, we call that a recurrence. The four most common cancers in the UK are breast cancer, prostate cancer, lung cancer, and bowel or colorectal cancer, large bowel cancer. And there are many different ways of treating each different type of cancer. For the most common cancers, the commonest treatment is surgery. And if you can remove it when it's small enough, often patients are cured. After that, we have radiotherapy, where we treat an area of tumour with radiation beams, and that also can shrink tumours and often cure them as well. Chemotherapy refers to treating cancer with chemicals, so essentially that just means drug treatment, and the drug treatments for cancer have improved significantly over the last 20 years. Approximately 40% of the population will get cancer in their lifetime. It's much more common as patients get older. But it's still very important, no matter what your age, that if there's a problem and you think there might be something that may be wrong, that you go to the GP early. And if we catch a tumour earlier, we've got a much higher chance of curing it.